Welcome back.
Back at it.
Back at it.
Yeah.
1 month over, 2 months for you, Louis.
Yeah, it's been a while.
Yeah. What do you think?
It's been great. I miss it. The last podcast was good. Amazon, right?
Yeah.
That's
you
big dog.
You watched
Yeah,
it.
almost equal to Chief Supply Chain Officer at Christiana. Close.
Well, fantastic. So, just for everyone, from welcome to the Health Intelligence Pitch, and from this perspective, we are saying, come for the insight, stay for the chat, and as always, we have got a fantastic group of anchors here, business executives who are primed to really, make a difference in the healthcare industry and are experts in the field. For those that are new to the podcast, the reality that we want to try and bring to everyone is executives who are very fresh, who are very innovative, that actually have the best intentions in mind to really, encourage people to, work in supply chain procurement and finance, and really to actually try and make a difference. So for everyone that's here, it's really good because, we're a small little family, I suppose. It's now been, a number of months that we have actually got together and addressed some,
How long has it been?
This is our third? Fourth
for Jeremy, third for me.
Yeah.
Boy.
Yep.
Already.
All righty.
Alright.
And just to remind the audience as well, we follow the Rugby Sevens format. And from that viewpoint, we've got 7 minutes. I'll read it out the context of the question. And the reality is you've got 7 minutes to answer. The first session is jointly, so we'll have 14 minutes to actually go ahead. But the key thing about this, as we have always said, is you have no idea about the topic.
Yes.
None.
And we actually have something on here, and you were taking some guesses with regards to what it could possibly be, what the topic could be.
Yeah, that's right. Yeah, we got cards, a magic 8-ball, some dice,
Some
gambling, some magic, risk-taking. Yeah, we'll see.
Okay,
Yeah.
so let's jump straight into it then.
Yeah, let's do it.
So, topic introduction. Every generation of executives believes it's making rational decisions. But today, the environment around those decisions are so ever fast-moving, right? Absolutely, and faster than ever before. It feels like, we're trying to actually build up a long-term roadmap and develop that. But the reality is the technology is actually coming together a lot faster than what you've actually planned for your roadmap. And when you actually think about the technology and how it's shifting, you got, narratives are changing, analysis is changing, signals out in the media, the influences that are out there, then AI is now helping to actually generate answers that people are actually putting in there to, come up with technology decisions. But basically all of us is moving a lot faster than anyone can realistically take control of. And somewhat inside all of that noise, leaders are expected to make multi-billion, million, in some instances billion, dollar decisions on technology, and how you actually got to try and justify that. So it's quite a big thing that you're making these massive investments, either for you or these executives that are, managing huge IT budgets, and literally spending billions, if not obviously hundreds of millions of dollars on technology and processes and business change. So today's conversation is about how healthcare executives make high-cost innovation bets.
Oh, got it. There we go.
Shall I shake it?
Yeah.
How we
That's
make
how
high
we do
cost.
it.
Yeah.
Shh. Roll the dice.
Rock, paper, scissors, shoot.
Flip a coin.
Okay, so if I look at the table that's actually here, the AI market in healthcare from a USD billions perspective has grown from 2025 and forecasted to be, look at that, a 38.9% CAGR rate. So 36 billion jumping to 505 billion in 2003. AI market in healthcare. Healthcare supply chain market size with regards to this, a CAGR of 10.62. Still significant, from 3.5 billion to 6.5. And just keep that figure in mind, North America representing 45% of the global market.
Wow.
That number will become very relevant, let's say, in the subsequent questions. But it's staggering, right? When you actually think about this. And so, when we're talking about this, topic where you've got to make these decisions, and if you're going from 36 to 50, then jumping up to $500 million, and you've got to try and make some of these technology decisions and recommendations, it's a big call.
Yeah.
Okay. So we're going to start the first block of questions, and I'll set the general context, and then we'll set the clock.
Got it.
Okay. So this will be the joint ones for the new listeners that are actually coming in. So general context. We live in a world where technologies accelerate, pivot, and sometimes disappear entirely within a year. For procurement leaders, this isn't an abstract problem. It's $1 million decision to make. And here's what makes it genuinely complicated. The pace of change, that means you have to make decisions, experience alone is no longer enough for the likes of yourselves and people in your position. So a head of procurement supply chain, and let's say his 20-year, I know you haven't been 20 years in procurement, but may go through 4 waves of technology.
Yeah.
Mm-hmm.
Okay. But the next one might arrive tomorrow.
Yeah.
Okay. So if we start the first question and set the timer. Your first 7 minutes start now jointly, and we can see who actually wants to go first. But first question 1. CapEx investment decisions. What's the approach on how to choose direction, and how does the buying journey look like, and how long does it last, and who holds the ownership? Who wants to go first?
For CapEx?
Mm-hmm.
Just in general, not just technology?
No, just in general. CapEx investment decisions, yeah. But then also think about technology, put it in that reference.
Yeah. So decisions owned by, it's driven by strategic initiatives, like your strategic mission, where you're headed as an organization, and it's getting more and more focused on what's it going to deliver ROI in either cost reduction, efficiencies, or revenue growth, right? What is it going to be drivers around those things? They get separated out into your routine maintenance stuff, right? You've got things like maintaining your foundational systems and technology, maintaining your facilities, things like that. But then you get into half your budget tends to be around that strategic, which is what we're kind of focused on here. And it is really driven around, at Rush, it's driven around, it's a committee of leadership that reviews that technology, and there's requirements to hit the ROI, et cetera, because it's all a prioritization game. We would love to spend $2 billion, but we don't have it, right? So it's a prioritization game of what's going to deliver, and we meet monthly to and it keeps getting reprioritized all the time.
Okay.
Yeah.
Okay.
Yep. At Christiana, we've been talking about this a lot. And the big opportunity now, we have a 5-year strategic plan, new CEO, and it's all growth. So to me, when I think, it's obviously owned by C-suite CEOs, operators, service line leaders, outpatient strategy, right? It's getting competitive in the Northeast where we're located, very competitive with Jersey and Philadelphia. So, but to me, that just highlights the opportunity that exists with the routine. We got to become efficient with routine because every dollar you shave there and save, you can reallocate to the growth strategy. So right now, one of the levers we're pulling in supply chain is we have a 5-year forecast of everything that should be coming up for replacement. And as we need to align on that, start strategizing around it, make sure that we got our contracts in a good place so that there's a lot of opportunity to save money there. And then hopefully be able to then highlight that to the CEOs and strategy officers and show like this is what we saved. Now we can reallocate this money towards growth.
But in the context of capital, for example, let's say in technology, where you've got to try and make, long strategic bets with regards to, for example, your implementation of Workday.
Yeah.
Okay. So we're going through something right now. I would say find a new source of water. Like don't go back to the same well. So in certain contracts right now for, big strategic vendors that we all use, they're trying to lock us into 6-year contracts. I think that's a response to AI. These bigger firms have to figure out how to compete. So they I don't blame them. I don't think it's a negative thing, but if they can lock in their customers, then that gives them time to invest R&D and figure out where they're going to land with AI, because some of them do move a little slower. Some of the smaller AI companies are moving very fast.
Mm-hmm.
So we're talking right now with a specific negotiation, and we're going to try to keep it at 2 to 3 years because, we don't know where this is going to be in 2 to 3 years. So we'd rather be prepared to pivot in a direction that has higher ROI or more value than be partnered with someone that's been around for a while. They have their role, but I don't know if they're competing in the AI space competitively yet.
Okay, hold that thought. Okay. I'm just trying to draw the central themes around this because, as you know, when we go out from a shorts perspective, it comes out. So, question number 2. What are your investments under management and procurement, be it consulting, services, technology? Just a high level. Just
like dollars, or what are we investing in?
What are you investing?
Yes, I would say similar to the example we just gave. I mean, we could highlight our partnership. I think even that's a good example. Like find wins, build momentum. Where are there new opportunities, and then double down on those. I would say our budget stayed pretty flat. I think we want to be aggressive with AI, but I think there's a tactical way to do it. Start small and build up. So yeah, I think a few dollars in consulting, mostly technology.
So investments are in technology, a lot of revenue cycle, to continue to enhance that and combat the use of AI by all the insurers. So there's a lot of focus there. A lot of it's around growth. So it's around growth, new clinics, new facilities constantly growing to continue creating that funnel. And then technology to enable that growth. So technologies around scheduling, ease of patient access, all those types of things is where a lot of the spend has been going.
Right.
Purchase services.
We'll
highlight that, yeah.
Mm-hmm. Okay. Question number 3 then. What sources do you apply to ensure you're making the right choice? And what are the further arguments that you can use and be strong with justifying the necessary investments? So keep it broad with regards to the thinking.
So how do we double down on our choices?
Yeah, how do you ensure that you're actually making the right choices? So what are, the arguments that you're currently using, to actually say, hey, we must go down this particular path?
Yeah, I mean, obviously typical ROI analysis. But I'd say the other thing we're doing better on is not just because it's not just like the routine dollars trying to tighten those up so you can have more strategic. It is making sure you have all your ducks aligned for whatever strategic initiative. When you're saying we're going to go down this road and implement this technology, is IT really lined up and ready to do it? Is contracting really lined up to support them? If there needs to be some new build out to support it in some way, is the facility team lined up to do all those things? Because we found that there's a lot of things like, let's go do it, and then it takes 6 months to figure out how to actually do it because it wasn't all lined up. And then you've already started pushing money out the door and you're really not aligned. So a lot of upfront, we call it feasibility analysis, but it's not just, that's usually used in the construction world, but we're using it in the technology world, saying, are we ready? Can we handle it? If it involves physicians, are they ready to handle it? Can they take that change? Like aligning those things up front.
Yeah, but put it in the context with regards to that's good at a general level.
Yeah.
Okay. But what sources are you, let's say, absorbing to actually make some of those decisions? So, who are you listening to?
Consultants.
Yeah.
There's a lot of consulting that's helping with picking those things.
How do you choose the consultants?
How do we choose it? Word of mouth, connections, what other people did, RFPs. But it's a lot of that. It's
okay.
Yeah.
I think there's so
a lot
many.
Of Google, GPT, ChatGPT.
Use AI to assess AI. Ask AI. I actually think this is going to sound like a soft answer, but I think that's probably why you're not getting the answer I think you're looking for. I think Jeremy hit it. For me, part of it is the people. What are you actually ready to absorb? Like that's become a thing. You can implement technology and move too fast, and you're actually not ready to use it. But there's so many quick wins in supply chain that the risk isn't high. So I think it's just lining it up to what your executives and your other leaders are prioritizing. So we know at Christiana we did a good job with PPI and commodities for the last 2 years. So as you're meeting with different vice presidents, you start hearing contracts, consultants, purchase services. All right, light bulbs start going off. It's been on our radar too. Let's align that this year. Then you have this now new model that we've been talking about in co-development. So to me, that's a lever we can pull. It's minimal cost with a potential high ROI, right? So I think you can do that a couple times. Like I can't think of many solutions. There's one solution that I could think about that's expensive and it better land, right?
Right.
That one's a riskier one. That one you need a lot of buy-in from a lot of leaders. Mm-hmm. The good news is the one that I'm thinking about is an enterprise-wide solution. So it was brought in by multiple leaders, and they supported it. A lot of the stuff that we've been doing in supply chain is like the upside's there,
right.
So the risk is low. So to me, it's just like finding the alignment with your organization. Don't do something no one cares about, unless you really got bandwidth. But if people are asking questions and you got a solution, bring it.
But I think you hit on it, Jeremy, that part of the discussion is around, who are you listening to?
Yeah.
How did you make those contacts with those individuals? Whatever consulting or individual that is barking in your ear, then the next part of that question, I suppose, that I'm trying to unearth here is, where did they get that information from? What qualification? So really, I'm just trying to actually explore from either of you, just at a very, very high level. Got it, understand, you've got to execute, you've come to a decision-making point, but there's been a long-winded process before you got to that particular point. And what sources did you use to actually get to that point?
I mean, it's really people. It's really word of mouth, trusted people that consultants that you've been working with, those types of things.
They've used it.
Yeah, they've used it. But it is still a lot of, and it's moving so fast. So it tends to be the people that you've been working with historically have more of a voice.
I could think of an example that Jeremy and I are aligned on. I don't know if I want to say the name, but we do have a lot of peers. People are excited about technology. I could think of one of our good friends that is investing heavy in this one technology. I think he had a call with you. He had a call with me. Heard him out. I didn't get it. So I did not sign the dotted line. So it's just one example of one where I love his passion, but to me I didn't see it as an immediate ROI or the big, like if I got a $500,000 to spend this year on technology, I got to use that wisely, right? So I want to use it on something that's going to drive financial impact. Maybe one day I can explore something else that maybe has an operational win or efficiency gain, but it's not going to drive true P&L impact. So I think we're talking to our peers, we're listening to a lot. I like talking to people who are using it that can talk about the impact. And if they're bringing those things up and it clicks, then usually for me that's enough to at least start. And then it's how you negotiate the contract to reduce the risk of your organization.
I would say from a supply chain standpoint, when I think of I was speaking organization-wide rather than you think about all of it. Supply chain standpoint, it's things like Gartner, it's going to conferences, it is seeing those things, but keeping your eye open for new technology and spots, but knowing where your pain points are. Purchaser is a big pain point. Is there solutions that can have, and it's then prioritizing them based on what you think you can get the quickest return on.
Right.
That's really what's driving a lot of it. We can get the quickest return, the fastest return on this problem area, and let's
go for it.
Yeah, go for it.
Okay, done.
Okay,
brilliant.